We're going to do the finishing of the bones for Lab 7, and we're going to focus on the ulna. And what I've done here is we put out a right ulna, a right radius, and a right humerus, roughly in the position they would go together. Not exactly, but pretty close. And we're going to use some of this relationship to tell the right from the left. So if we take the ulna, we see that right here we have the trochlear notch or semi-lunar notch, and that's where the trochlea of the humerus and the ulna articulate. Right here on the lateral side, we have the radial notch, and the radial notch is where the head of the radius articulates with the ulna. And then distally, we have the head of the ulna, and that's going to articulate with the ulnar notch of the radius right there. So we can tell that this is a right because the radial notch is lateral and the radius will be lateral to the ulna. Okay, so we have a couple of landmarks we want to make sure we hit. We have the coronoid process, and the coronoid process is this piece that's supposed to look like a crown. We have the head, which I've already mentioned, is at the distal end. This is the head down here where it articulates with the radius. We have the olecranon process. The olecranon process is this piece of the ulna here, kind of comes up, and the triceps brachii actually attaches to this, so it's a fairly substantial attachment. We have the radial notch, which I already mentioned, it's on the lateral side where the head of the radius goes. We have the styloid process. Styloid process is medial on the ulna, whereas it's lateral on the radius. The styloid process, the radius there, styloid process of the ulna here. So that is a medial projection. And then we have the trochlear or semi-lunar notch. If I were you, I would call it the trochlear notch because it goes to the trochlea of the humerus. Semi-lunar doesn't make any grant thing out of it, but trochlea, the trochlear notch does. So there's a trochlear notch of the ulna, and that is your right ulna.